to move that this House do now adjourn.
Now we're on to the adjournment debate. The question is that the House do now adjourn. Sarah Dyke.
Thank you, Madam Deputy Speaker. I'm grateful to have this opportunity to address the House on World Stroke Day. Stroke is the UK's fourth biggest killer and the single largest cause of complex disability in the UK. On our current trajectory, the number of stroke survivors will increase by 60% over the next decade, which will swallow up nearly half the current NHS budget. By that time, 1 in 3 people in Glastonbury and Somerton will be 65 or older, so we will be disproportionately feel the impact of the increase in strokes over the next decade.
On that point?
Of course.
Madam Deputy Speaker, can I first of all congratulate the Honourable Lady for Glastonbury and Somerton for bringing this forward? And she mentioned the age of 65 is really important. In Northern Ireland, some 2,800 new strokes in Northern Ireland every year, while the majority of strokes are people who are over the age of 65. It can strike at any age. 25% of people have a stroke under the age of 65. So does the Honourable Lady not agree that we must take away the notion that stroke awareness is only for older people, and we must be very aware of the FAST signs, F-A-S-T signs, that can make a difference between death and recovery? It can happen to young people as well.
I thank the Honourable Member for making a really important point. Although we often assume that it's older people that suffer with strokes, absolutely, there are so many young people who suffer in the same way. But, Madam Deputy Speaker, similarly, unless there are major improvements, Somerset's poor ambulance response times and poor life after stroke care will mean a disproportionate amount of the 42,000 people that would die from stroke in 2035 will be from my constituency. Of course.
I thank the Honourable Lady for giving me, and also further to the point that the Honourable Member for Strangford made. Although I fully accept that we have to do more in terms of stroke care, does she agree with me that the population in this country is generally unaware of the early warning signs to look for stroke? When it actually happens, they recognise the symptoms. But the long-term warning signs we have no awareness of, and we need to invest in teaching people what to look for and how to care for themselves to avoid a stroke.
Thank you. I thank the Honourable Member and Honourable Friend for making such an important point. I think that we have progressed in our understanding of stroke awareness, but there is so much more yet to do. Madam Deputy Speaker, neither strokes nor the grim predictions that I've made are inevitable. Stroke is preventable, it is treatable, and it is recoverable. Of course.
Would you allow me to place on record my thanks to the innovative team at the stroke unit in Cross House Hospital, whose new treatment thrombolysis means that, as she said, there is a way for many people to recover post-strokes. And I'd like to thank charge nurse Elizabeth, consultants Martin and Sundeep, and Julie and Debbie and the hospital management team for saving my former teacher Christine Stewart when she self-diagnosed with FAST. Thank you.
I welcome that intervention. He makes a very good point, and I also celebrate those people who do such hard work within their communities. The UK knows how to deliver world-class stroke care, and some parts of England are doing that as I speak. Stroke is one of the few conditions that takes patients through the entirety of the health and social care system, from emergency services and acute care to social care, specialist rehabilitation support and end-of-life care. Yes, of course.
I'm really grateful to the Honourable Member for holding this debate. Time is everything with regards to a stroke, particularly around diagnosis, but also if treatment is needed, like thrombectomies. Does she agree that we should be looking at the ambulance response times in particular, and perhaps recategorising stroke into a Category 1 call-out?
I thank the Honourable Member for her intervention. I thank her for all the work that she has done on this. And I will come to ambulance response times a little bit later on. But, Madam Deputy Speaker, delays in urgent care are currently leading to high mortality rates, and post-stroke services, which provide crucial emotional, practical and social support, are often treated as optional rather than essential. This means that our health and social care services...
Thank her for giving way and for bringing this important matter forward. She rightly talks about the need for stroke patients to receive urgent medical treatment. Last month I attended a thrombectomy awareness event at which my constituent Mark Patterson was speaking as a stroke survivor, and Mark's remarkable recovery was thanks to the emergency thrombectomy procedure he received. Sadly, many others are not so lucky, with too many people dying or suffering disability due to the previous government's postcode lottery in care. I think last year, about this time last year, the Stroke Association said that in London, about 9.8% of patients were receiving treatment compared to 0.4% in the East. So does she agree with me that we need to see an increase in the proportion of patients receiving thrombectomy across the country?
I thank the Honourable Member for his intervention, and he makes a very strong point. Madam Deputy Speaker, our health and social care services are likely failing the 14,159 registered stroke survivors in Somerset at some stage in the system. There is reason to be optimistic, though. If the government put stroke at the heart of our health and social care system, each and every part of the system will be stronger and deliver better outcomes for everyone, not just stroke survivors. Now, leaving aside the human cost, there is also an economic cost, with strokes leading to an avoidable £1.6 billion of annual loss of productivity. Madam Deputy Speaker, I recently spoke to Gary, who works in Somerset and had a stroke in his 30s. He told me that he could have been back to work after 9 months if he had had access to life after stroke care. Instead, he spent 5 years recovering, and during that time, he had to rely on the benefits system. Now, at the start of this debate, I said that stroke was preventable, treatable, and recoverable. If it is true, and I know that it is, why are people like Gary forced to waste years in the prime of their life learning how to recover from strokes themselves? Yes, I will.
Thank you, and thank you, Madam Deputy Speaker. I think the Honourable Lady is making a very important point. Our clinical profession do an incredible job of saving many of the people who suffer from a stroke, but that rehabilitation work that follows surviving a stroke, that ability to get back into work, to build up emotional confidence and rebuild relationships is so important. And I think, as she was detailing, too many people who survive strokes are then having to wait years to get back on with their lives, either in work or in their friendships or relationships.
I wholeheartedly agree with that comment, and it is exactly the point that I was making. Research from the Stroke Association shows the NHS faces a £1,300 worth of additional pressure for each person like Gary that doesn't receive life after stroke care due to avoidable secondary strokes and other health complications. It is an injustice for stroke survivors that are suffering longer than they need to, for the taxpayer that could be paying less, and for the friends and families that often have no choice but to become unpaid carers to support them, like my mum did for my dad after he suffered a stroke. Unpaid carers currently bear 62% of the cost of prevalent strokes, with the NHS and social care each only bearing distant 9% and 22% respectively. Unpaid carers do a remarkable, important and often invisible job, and this government must ensure that they have access to the support that they need, including paid carers leave and a statutory guarantee of regular respite breaks. Now, I know there aren't many easy answers when it comes to stroke. I have constituents from across Glastonbury and Somerton who write to me almost every month since my re-election because they are concerned about the closure of Yeovil District Hospital hyperacute services. It is right that steps are being taken to address the fact that 60% of people that arrive at hospitals don't get into a stroke unit quick enough. The reconfiguration of these services is being made to provide patients with cutting-edge care in Dorchester or 4 in Taunton. By concentrating these hyperacute services, patients can move through the system quicker, which is so important when caring for patients who are suffering from a stroke. But, Madam Deputy Speaker, after critical care has been provided, patients will be moved back to services closer to their home, like Yeovil, for example, so family and friends will be able to visit their loved ones there rather than the critical venue further away. But I can understand why people are scared of potentially having to travel further in an emergency when response times are so poor. In fact, with an average response time of 42 minutes and 50 seconds, people in Somerset wait longer for an ambulance than anywhere else in England. For every minute a stroke is left untreated, nearly 2 million brain cells die. So fast ambulance response times are necessary for getting stroke patients life-saving, disability-reducing treatments in time. This is especially important for those living in rural areas like Glastonbury and Somerton, who may need to travel further for treatment. Liberal Democrat analysis revealed that waits for life-threatening calls are 45% longer in rural areas than in urban ones. The average handover time for a Category 2 ambulance call in Somerset has risen to over an hour, despite the ongoing 18-minute target, which results in ambulance crew only being able to see 2 or 3 patients per shift. The government could lower these ambulance response times by increasing the number of staffed hospital beds and ensuring our social care system is resourced well enough to allow people to recover outside of hospital. We know that a matter of minutes can make all the difference in emergencies, so it's heartbreaking to see ambulance delays are worsening and stroke victims are being left for hours for help to arrive. Now, I'm inspired by the Stroke Quality Improvement for Rehabilitation project, which has helped over half the stroke survivors that were previously being failed by services in Somerset. The pilot has ensured that survivors have access to personalised and face-to-face support to help them with the behavioural changes and re-entering work. Despite its success in preventing secondary strokes and thus saving the health and social system care a great deal of money, the pilot is unlikely to receive funding from April next year, and 250 patients in Somerset face the prospect of losing access to good quality life after stroke support. I am particularly worried about stroke survivors in Glastonbury and Somerton and elsewhere in Somerset who will instead have to rely on Yeovil District Hospital if this happens, as Yeovil District Hospital provides only the minimum level of occupational therapy, physiotherapy and speech and language therapy a week to less than half as many patients as the national average. Therefore, it is a future where we can no longer have a World Stroke Day, and that is what I'm looking for, a future without a World Stroke Day. Innovations like this, like the use of artificial intelligence in diagnosis, could revolutionise recovery prospects for stroke patients, and preventative programmes could limit the impact stroke has on working age people. We saw stroke mortality halved in just 10 years when stroke was prioritised in 2000. So progress can be made. If we are to reach that future, though, we must start by ring-fencing budgets to enable the NHS to adopt innovative digital tools, invest in new technologies and develop a digital strategy. This government has already begun to make some progress with the Darcy report, which showed the NHS on its knees after years of mismanagement by the Conservatives, but we must ensure that stroke remains a top priority in their health mission. Yes, I'm just coming to the end, but yes, of course.
Thank you. I thank the honourable member for giving way. I just would like to share my experience. On my first day here in the Commons, my husband suffered a stroke. And this is a timely debate, so I want to thank you for securing this. I'm pleased to say he's doing much better now, and he is here in the chamber, as are the Stroke Association, who have been absolutely invaluable to our family and many stroke survivors across the country. I would like to pick up a point that the honourable member made about strokes. 1 in 4 strokes happen to people of working age. and 1 in 3 in this group will have to give up their jobs. It is very, very clear that though the NHS has given excellent care to families like mine and to my husband, there is clearly much more to be done. The Darzi report revealed the scale of the challenges that our health service face, especially the impact to stroke services in our country, the severe impact of the underfunding of the last Conservative government.
Thank you. I thank the Honourable Lady, and it's so good to hear that her husband is making such a full and quick recovery. But Madam Deputy Speaker, World Stroke Day is a pertinent reminder that stroke must be well represented in the new 10-year health plan, and that the government must engage with patients, with carers and health and social care professionals so their lived experiences can help inform policy decisions. Thank you.
Call the Minister to respond. Minister Stephen Kinnock.
Thank you very much indeed, Madam Deputy Speaker, and I'd like to start by congratulating the Honourable Member for Glastonbury and Somerton for securing a debate on this vitally important issue. Important not only for her constituents, but also for her personally, I think, given her family circumstances, and I know she really spoke from the heart, and we appreciate that. Good health should be fundamental to all of our lives, but that sadly is not the case for too many people. Over 100,000 people have a stroke in the UK every year. That's one person every 5 minutes. 1/3 of them will be left with some form of long-term disability. As the 4th largest cause of death for adults, stroke has a devastating impact on the individuals, their families, and wider communities across our country. Now, for decades, the NHS has served us well, and it's, of course, one of the proudest achievements of the party on these benches that we were at the foundation of our NHS. Our staff have tremendous expertise and dedication. They're working hard every day to make a difference. But we have to face up to the reality that we've had 14 years of neglect and incompetence on the part of the Conservative Party, and we are now facing a very significant set of challenges in terms of looking to get our health and care system back on its feet and fit for the future. So I think it's an important context for this debate, but I am very grateful to the Honourable Member for giving me the opportunity to inform her and the House of the work the government's been doing since we came to office on the 4th of July, and particularly as today, of course, is World Stroke Day. The House will have seen that we have set out the 3 transformative shifts that we want to deliver in health and care, moving from care from hospitals into homes, prioritising prevention over treatment, and advancing from analogue to digital solutions. These 3 strategic shifts will be the building block of our health mission, reducing time spent in poor health, tackling health inequalities, and reducing the lives lost from the biggest killers, which include cardiovascular disease. We have to change the NHS so it's no longer just a sickness service, but a prevention service too. Prevention is always better and cheaper than cure. So we have to take preventative public health measures to tackle the biggest killers and support people to live longer, healthier lives. That's why in our health mission to build an NHS that's fit for the future, we've committed to reducing deaths from heart disease and strokes by 1/4 within 10 years. The NHS Health Check, England's flagship cardiovascular disease prevention programme, aims to prevent heart disease, stroke, diabetes, kidney disease, and some forms of dementia. Each year, the programme engages over 1.3 million people, and through behavioural and clinical interventions, prevents around 500 heart attacks or strokes. To improve access and engagement with this life-saving programme, we're developing a new digital NHS Health Check, which will be ready for testing in early 2025 and will enable people to undertake a check at home. We're also trialling more than 130,000 life-saving heart health checks in the workplace. These checks can be completed quickly and easily by people at work. so that they can understand and act on their cardiovascular risk and reduce their future risk of a stroke. Around 50% of heart attacks and strokes are associated with high blood pressure. Community pharmacies are providing a free blood pressure check service for anyone over the age of 40. In cases where this results in a high reading, pharmacists can make sure people receive the right NHS support to reduce their blood pressure. We know that there is more to do to prevent the causes of stroke, and the Department and NHS England are working together to tackle this issue. I'm also pleased to announce that on Monday the 4th of November, NHS England is launching a new Act Fast campaign to increase knowledge of the main signs of a stroke and to encourage people to dial 999 immediately in response to any sign. The new campaign builds on the success of the previous Act Fast campaign using a revised call to action. And I quote, "Face or arm or speech, at the first sign, it's time to call 999. I will give way.
Thank you. I just wanted to pay tribute to a young man who lived in Shepton Mallet, and his name's Will, and he spotted what was happening to his father and was able, therefore, to make sure that he's a young man with some difficulties himself, but he recognised FAST. He'd seen it on television, and it's an absolute testament to the power of television and radio campaigns to make sure that those messages get through, because that young man has difficulties in communicating and in moving, but he managed to get the rest of his family to realise what was happening to his father sitting there across the breakfast table. So I just wanted to mark that. Thank you.
Honourable lady for that telling intervention, because she's absolutely right. So much of both the challenge and the opportunity before us is how do we use traditional media, social media, all forms of communication and awareness raising campaigns and techniques, because by definition we're dealing here with a situation in which speed is of the essence. It is something which is truly a public health challenge, because it's only the public that can really do what Will did in that circumstance. And I'd certainly also like to pay tribute to Will for acting so quickly, but also to the Act Fast campaign. So I'm sure that members on all sides of the House will welcome the fact that we are looking to build on the success of Act Fast and to replicate and renew it. That campaign will run in England across TV, radio, social media, national press, and ethnic minority TV and radio stations. The campaign also includes specific communications for multicultural and disabled audiences. A higher reduction in mortality rates over the next 10 years will require a focus on NHS England's stroke priorities, including rapid diagnosis and increasing access to time-dependent specialist acute stroke care. We know so many deadly diseases can be avoided if we seek help in enough time. That's why we're working to improve access to treatments. Current targets include increasing thrombectomy rates to 10% and thrombolysis rates to 20% through facilitating ambulance service use of pre-hospital video triage and use of AI decision support tools for brain imaging in comprehensive stroke centres. And I know that my honourable friend has a keen interest in that issue.
Yeah, so thank you for giving way. Building on the point made by my honourable friend, the member for York Central earlier, does he agree then that stroke patients should have the highest priority for ambulance call-outs, as high as cardiac arrest, for example?
I thank him for that intervention. I'm a little wary of generalising too much, because I know that so many decisions have to be made in real time by our skilled ambulance drivers and paramedics and many others involved. But I think that he makes an extremely valid point that in a general sense, he's absolutely right, that it does need to take priority. And as I think one of the red thread going through this entire debate has been the need for speed, and it's all about prioritising and acting quickly. So I think he's absolutely right about that. We've seen in the last year a 30% increase in the number of thrombectomies delivered in England. Alongside this, our 20 integrated stroke delivery networks are looking to optimise care pathways. The GMC is addressing critical workforce gaps through its thrombectomy credentialing programme, and our national optimal stroke imaging pathway is improving information sharing. Now, I'm aware of the reconfiguration in the Honourable Member's constituency. There's been a decision by NHS Somerset ICB to close the hyperacute stroke unit at Yeovil Hospital and to establish a single hyperacute stroke unit at Musgrove Park Hospital in Taunton, providing 24/7 emergency treatment. All service changes should be based on clear evidence that they will deliver better outcomes for patients. There is a high bar set out in guidance for intervening in contested reconfiguration cases, and reconfiguration of services should be a matter for the local NHS. I would expect all avenues of local resolution to have been exhausted before a call-in request is made. The department has received a formal call-in request to call in NHS Somerset's ICB's decision. Ministers will make a decision on whether to use their call-in powers on this matter in due course. Now, we know that unfortunately there is still significant variation in access and outcomes on stroke across the country. For example, the percentage of suspected stroke patients who receive the necessary brain scan within an hour of arrival at hospital varies from 80% in Kent to only around 40% in Shropshire. So that kind of variation, that needs to change. We need to bring the best of the NHS to the rest of the NHS, and that, I think, is going to be one of the central challenges for this government going forward. This government has a profound ambition to improve the lives and health outcomes of people in this country that survive a stroke, and it's at that point I would like to pay tribute to my honourable friend and also to the man in the gallery there for what they've been through and the fortitude with which they have gone through this whole process, and certainly not easy for my honourable friend coming to this place and having to go through that extremely difficult situation, but also pay tribute to all of the key partners and stakeholders that worked with my honourable friend and her family to get through it. That really is a tribute to the immensely important work that they do.
I'm grateful to the Minister giving way, and as well as looking at the acute triage, essentially to rapidly diagnose people who have had a stroke, it's really important to invest in rehabilitation for people, something that I did for 20 years in the NHS. So I would be really grateful if he could set out how he proposes to have an integrated rehabilitation team which doesn't see people just through the immediate aftercare of somebody having a stroke, but continues to provide that top-up for people so they can continue to ensure that they don't backslide in their rehabilitation.
Thank you very much. I can say a word about our national service model for an integrated community stroke service with a number of specific projects aimed at improving delivery of psychological rehabilitation. The ICSS model is vital to support psychological recovery, return to work and improved quality of life, but I'd of course be more than happy to discuss that further with my honourable friend. So before I close, I want to recognise the remarkable work of the charities that help people across the country rebuild their lives after a stroke. Once again, thank the honourable member for this very important debate and encourage every member in the House to go on to change.nhs.uk and get involved in the biggest conversation about our health and care service since its foundation in 1948. Thank you very much, Madam Deputy Speaker.
The question is that this House do now adjourn. As many of their opinions say aye? Aye. The ayes have it. Order, order.